Hi, welcome everyone. My name is Igatham. I'm DHIS2 Community of Practice Coordinator from Sana'a, Yemen, based in Yemen. And I'm happy to be your host today for the end of year event. Just quickly tell you, I've been with DHIS2 community for about 4 years now, working with the DHIS2 core team and the community. And I can say this is one of the best things and experiences that happened in my life because of getting to know a lot of people in the community and learning about DHIS2. One special thing, I'll be very quick and short. One special thing I want to say that is my favorite in the DHIS2 community is the COP monthly post, because it's a monthly post where we have a list of the helpful community members every month, the most active members, and the top topics, as well as a deep tries to challenge and a community map. So today is the end of year event, and we've had three events like this before, where we have helpful and active community members present about their experience in the DHIS2 community. So this is our fourth annual event for the end of year 2024. We have three presenters as well, presenting about the DHIS2 community experience and what I will do is between and after every presentation, I will be giving and sharing some COP fun facts. And I'll leave the introduction for our helpful community presenters today to talk about their experience and to introduce themselves. In addition to the speakers, we also have a special developer talk by Asma Maki from the DHIS2 core team, and we'll have an interactive community and developers questions. So let me start with some fun COP facts, and then we'll move to the community presenter. First fact here is you can find the DHIS2 core team on the COP. So if you go to the community website and click on users, then in the groups you can select DHIS2 core team. From there you can have a list of the DHIS2 core team members in the COP. Another quick fact is, so members who visited more than 230 plus days in 2024. Thank you for being dedicated to the community and visiting quite a lot during the year. And also this filter, this page, you can find it from the users page, and you select the period as yearly, and then the filter that you want to check out. And then the oldest COP account last seen this month. So Greg joined in July 7, 2011, and was last seen 7 minutes before I took the screenshot, but during this month. And there are other accounts that are much older, but this account, I chose the one that was also last seen in December. What level of experience do you have with DHIS2? So in the community, when people sign up to join the community, they're asked this question. We have 771 people who said they are experts at the advanced level, and more than 3,000 at the intermediary average. Probably people who have completed academy, the online academy courses as well, and have had maybe experience with DHIS2, and quite a lot, more than 5,000 but beginner learner, but that's great. That's the spirit, right? We're all still learning from each other as well. And the funniest country name by a COP video game fan. When I read this country info from a COP user, I really laughed. But this was before we changed the country here into a drop down. Makes you think about the choices when you create fields in DHIS2 as well. Do you want to drop down? Do you want an option set? Or do you want a free text and get results like this? And then members who received most likes during 2024, thank you for, I mean, this is, I don't have to say thank you, the community is already thanking you, ICT and Olympic. So you received the most likes during 2024. And this is gonna be the final fact for now, which is new members from 2024 who gave out likes the most. So we see people from Spain, new people from 2024. So accounts that are created in 2024. They gave out most likes. We also have Nigeria and the other top number of countries here. And now I would like to ask Matthew, please. I'll stop sharing my screen. If you'd like to jump into your presentation.
Sure. Let's see.
Okay. Thank you.
That work?
Yes.
From my side, yes.
Perfect.
Great.
Thank you, Kasim. Thank you for this opportunity. I am very excited, honored, and yeah, feeling very privileged to be here in general. And that's honestly my presentation. I'm just very happy that this exists and very happy to be here. I'll spend 5 minutes saying exactly this, but that's the takeaway. Let's see here. Okay. That's presentation points. Basically my experience with the community of practice has been, to be completely honest, really, really stellar, particularly after the insertion of Kasim and really, I think, elevating the level of the community of practice so much and making it with the monthly posts, but also just having it be so consistent that when there is a question asked, there will be a response. And many times it doesn't have to be Kasim, which is amazing and to the credit of a lot of incredible people who are very committed to the practice, but also just in case that does fall through, it's amazing to know that Kasim is going to be there and kind of pick it up and reference people and make sure that everything really gets its due respect and response. I don't have, when I came in, I was one of the people that said that I was, the 771 advanced users. Completely not the case at all. I could basically spell DHIS2 and I was pretty proud of that. But outside of that, I was coming in, was being told that I was the system administrator of a major server. And I was like, yeah, totally. I have Google. I'll be able to figure it out and we'll get there. And very quickly, the Google I realized was Googling to community of practice. And very quickly, the community of practice was the place where, I cut my teeth on the full understanding of do's and don'ts, to be completely honest. Documentation came back and forth. And eventually I started getting better at making the JIRA tickets to be able to leverage what I understood to be actual problems that I needed to be fixed versus things that I was really doing inappropriately or that could be done in a better way that really weren't necessarily a DHIS2 flaw or feature that I should be requesting. Anyway, I think one of the big benefits or kind of keys for this being, for me, such a valuable community practice is the fact that it's so interlaced with people at such different levels of expertise, but also legitimately gets you access to the people who are writing the codes, who are looking for user experience feedbacks, and based on that, making intentional edits and spending their own time to really deep dive into things. It's like, for me, one of the most fun things is writing a question on community practice that gets, I think his name is Jim Grace, but to get Jim's response on, because after Jim responds on it, you just kind of feel like his mind is working in the back on these codes. And I've noticed times where afterwards at the University of Oslo conference, he'll mention those posts and reference the hours that he spent in the back end and made small little customizations into, I forget what it was. I think it was some kind of a regex change just to make it more user friendly. But that kind of that kind of power with simply posting something on the community of practice and having it go back into the actual code of the source is just, I find it incredible. And just being active on community of practice has just been extremely valuable. And so I've listed some of the pictures here below. These are the people, for me, in my experience, when I either see a question from them, it really piques my interest because they're at, all of them are at a very high activity level. But also, when I get responses, I'm also really excited as well because I know it's coming from a place of a lot of experience and time. Some of these are core members, but a lot of them, and these are just random, as I was looking through community practice for this presentation, I grabbed a few, but a lot of them aren't. A lot of them are just people that I've come to trust. Willem Beck is a big one. I've never met Willem Beck, but I definitely appreciate the fact that he's so active. I think I can, well, yeah, I'll stay on this one. Another one is just the M symbol. I got very acquainted at early on in my time, both with the JIRA ticketing, but also in community practice. Whenever I got Marcus to respond to one of my messages, I was excited because I knew that meant he was going to consider, usually come back with specifications or detailed requests back for me. But it's funny, another big thing of why I really appreciate the community of practice is when I was able to, I think 3 years ago, go to my first Oslo conference. I'm not somebody who's going to show up at a conference and has the like business mindset of connecting, and it's with and this is like a networking. I understand that that's the value of it. I understand like theoretically that is very important. I don't have a lot of experience in that skill. So I was walking in and kind of wondering how this was going to go, if I was going to be in the corner, just trying to look at name tags and act like I know someone. But because of the community of practice, it's kind of like I was walking in and it was kind of like a red carpet, if you will, of celebrities that I knew about for years and years, but I never actually met. And interestingly, it was Marcus who came up to me and was like, "You're Matt." And it was cool because there was a back and forth. He also has seen and heard from me for many years. So it makes you feel like you're part of the community. So it was a very, I guess, a warm reminder that there's a lot of benefits in your practice, especially if you do get the chance to meet people in person. It's very rewarding, and it allows you to get to a very, very quickly to a conversation that's really valuable for DHIS2, but also just leveraging that and kind of being able to have those communications, just amazing. So yeah, I think maybe I'll make sure if I've touched any of these, if I haven't. One of the things that I think I was making a concerted effort about the last year was actually spending more time consciously on community of practice and trying to answer questions. Because I have benefited so much, and also just because it felt like it was interesting to kind of look and see what was going on. And I thought at the early onset that was me kind of making a selfless act, that I was like, I think I have this time. I think that would be nice to do. And I think, it's kind of been paid to me. I think that would be fine. And I guess unsurprisingly in hindsight, but that actually was extremely selfish, and actually, because not selfish, but it was so as much, or if not more, valuable on my side to answer those questions, or to like at least be tuned in for whenever there was a question. I was going to look at it, I was going to consider it, and I was going to respond. And a lot of times my response was, I don't really know. I'm probably not the person to ask. It might be Gassim or whoever I thought might make the most sense. But then I would also challenge myself to answer it. And it just, so obviously, I suppose, on hindsight again, but that was all really valuable in my ability to understand DHIS2, not just for what I am doing with my projects, but also what we might be doing, because I feel like, at least for my work, you're fielding questions. You're always people saying, can this work for DHIS2? And your response is, yeah, maybe, but there's there's 1,000 different ways in which we could do it. And so getting down from not just saying, yeah, it's possible, to actually being able to kind of have a more detailed response just requires a much more holistic understanding of both what is possible, problematic, optimized for DHIS2. And so just being really active in the community of practice, I think started out to me as me being a nice thing for the community of practice, ended up just being really valuable to be good at my job, honestly. And so was really, really good time spent for me. And then it also just kind of have it has had kind of exponential effect and positive impact for me in my work. Just being more active there has allowed me to have every once in a while kind of direct messages with people that I would never have imagined I'd be able to get access to, or people are asking if I would like to test out the Android a few days in advance, or people are saying, does this edit make sense for you? And that's not because I know very much necessarily or have definitely any kind of background in anything really that fancy. It's just because I'm active. And I think there's a nice, it's very genuine. I feel like, the thing that UIO, it feels like really just wants, desires, and backs up on is just activity, user stories, responses, and just people that are committed and willing to explain in good detail, ideally, what's going on and what would have been ideal, how you worked around it, and how it's going, basically. And so that's pretty easy. You just got to kind of do it. And it's been a ton of value to do that and get responses back. I think this is my last slide. One of the things I wanted to these are just thoughts, something that I think I've bugged Phil about in Oslo as well. But it's just, I think it would be cool to see things, because I consider the community practice so dynamic, right? If you leave for a week, you get busy on projects and things like that. You come back in a week, then all of the posts are completely different, right? And that's to its credit, because obviously it's, I think Kasim just showed us 10,000 members in the community of practice. Everybody's got questions, everybody's responding. Things that are 3 years old becomes 2 days old. That all makes sense. But I think there's a lot of trends and things that are found out, discovered, and also things that keep coming back over and over again of like, yeah, no, this was a problem, and I think there are some of those kind of recurring issues of not easily understandable issues within the DHIS2, or new features that we are continually brought up as like, actually, that is possible now as of version X, Y, and Z. I feel like it would be really cool to start to leverage the things that are being discovered, the more impactful discoveries, innovations, workarounds, or the very common things that should be avoided, and somehow leveraging that into the play servers. I think that would be really fun to be able, even potentially, to have people who have specific problems and or unique project deliverables, to be able to put them for an amount of time and onto play servers, to be able for members and kind of those key super users as well in community practice to be able to be like, we don't need you to share your metadata because it's on play. Let's go. And okay, I've set it up in this way on play. I think this makes sense. And then allowing that to kind of like scaffold a little bit more and have a little bit more power of, just the community of practice being what it is, driving the innovation and also the best practices of the DHIS2. So I think that would be really cool. And I've been pretty vague about this. I'm not exactly sure how that would look like, but I would think it'd be really a fun conversation to see. And maybe for next year or the coming years, it'd be fun to play around with that and see what kind of value there might be. I think that's it for me. I really love how active everybody is, and am fully committed to being selfless, aka selfish, next year and being super active. So look forward to seeing you in the chats. Thanks very much.
Thank you, Matthew. Delighted to hear from you, and it's great how every year we have the speakers talking, and there are a lot of shared things, shared elements in what they say, as well as new things that they are presenting. If you have seen the post from yesterday, announcement post, which has a series of webinars announced in 2025, which will be talking about DHIS2 features and some of the things that that might interest you as well. And when you mentioned play, it's also one of the most sites that I open while I use the community. So I definitely believe that your suggestion would definitely help the community. Very quickly, I'll go back to my Aponte OP fact before I ask our second presenter to present. So the first like ever in the community of practice was from Scots in 2018. I don't know how many people knew that, but it's an interesting, you know. And then the first like in the year 2024 is from Melina, the first day during the year. And then what are the maximum number of likes in a single day that happens in the community practice? So in September 2020, we had 127 likes. And those likes during that day were not for only one specific thing and not from one person. There were a number of different people and different number of likes for different posts. So that was the top number of likes during a single day. And also in June 12, 2024, we had that's the maximum number of people giving out likes, 49 people during a single day. And then new members who created their accounts in 2024 who received likes the most are from Nigeria, and then Spain, Malawi, Ghana, Uganda, Pakistan, and Tanzania. So those were the top likes receivers, those who received the likes the most. So, James, I think if you'd like to go second, please. You can start by sharing your screen. Okay, thank you.
I think I'm using my phone here to join the meeting. If you can share the screen, then maybe I can present.
All right. Yes. Okay. Okay. Sure. You have your presentation. I'm sharing your presentation in just a second. Ready now, sure. Please tell me when you can see my screen.
All right. Thank you, Mr. Gassini. Hello, everyone.
Okay.
I'm glad to be here with all of you and to have this opportunity to present in the ENIA event. I would like first to thank Mr. Gassim and all the members in the community of practice for giving me this opportunity. Today I will be presenting, but not only me, but the whole team in the whole digital team in South Sudan. Because the things that I will be presenting, it's part of the things that we did as a group in South Sudan to make sure that we can transform the health management information system in South Sudan. So I'm by name James Wani, knowing as Wahid, South Sudanese by nationality, holding a degree in computer science. My journey with DHIS2 began in October 2019 when I started managing the South Sudan Health Info. That system was designed to collect and manage the data from health facilities to give the Ministry of Health and the senior management a picture about what is happening at the facility levels and what is the challenges that the health sector in South Sudan is facing, so that the senior management can take action based on those data that we are collecting. Can you get next, please? Yes. So the translation of South Sudan from 1.4 DHIS 1.4 was led by Dr. Richard Lakou, the former Director General for Policy Planning, Budget and Research in the Ministry of Health, with support also from Mr. Achaka Taban, the Strategic Manager, seconded by IntraHealth International, and currently he's the Executive Director of HIP South Sudan. And also during that time, we had two colleagues, local expertise, Mr. Edward Ladu and Mr. Victor Misaka. Also, they combined the team with international consultants, Mr. Ayuk Manya from HIPS Kenya and Mr. Wilfred Signoni from HIPS Tanzania. So through their work together, they managed to upgrade the DHIS 1.4 in the country to DHIS 2 so that the country can have the new version with the new functionalities. So in November 2019, I began using DHIS 2 officially, and I was really impressed with the features, the advanced features that the DHIS 2 was having compared to the system that I was developing and I was managing it across the country. In the mid 2020, the local two colleagues who are managing the DHIS 2 in the country, they left, they joined implementing partners, and during that time, there is no one in the office apart from me. So I decided to take that role to be the new DHIS2 administrator in South Sudan. So during that journey, I faced a lot of challenges as a new person who is using DHIS2. So most of the time that I was responsible to do the end user training and also to fix these minor user issues, like for example, creating new user accounts, fixing, assigning and deassigning the data sets at the organization unit, and also support the M&Es in the data analysis and so on. So the main challenges that I faced during that time, there is no a backup team that I can rely on because we are not associated with any expertise that in case maybe I have a problem, I can contact them and they can provide me with feedback. So it became a challenge during that time. And most of the user manuals and training slides that we have during that time, it was only for data entry and also a data analysis. In addition to that, during that time also, the country was not having efficient resources to send someone to attend the DHIS2 academies, so that also that person can manage the DHIS2 internally. Next, please. So after I faced all those challenges, I start Googling in using Google. I start posting some questions there to see where I can get some answers and all those kind of things. But most of the time, the Google is direct me back to the DHIS2 community. So I joined the DHIS2 community where I found that all the experts and the new users, they're all in one place and people are freely to ask questions and they can get those kind of response. And through that, I create my account and I start posting some few questions there, and hopefully people have to start responding to my questions. And most of the time, those issues that I was facing is the real issue that I need to fix on daily basis in the country. So through that kind of practice, I managed to get some information on how I can fix some minor issues within the system. And also I joined the academy, the online academy, and I managed to do the fundamental, the tracker, and all those kind of free academies online. And through that kind of interactive, I managed to manage the DHIS2 system in South Sudan. And also what I did, I start documenting some of the steps. Like for example, whenever I post something there in the community and someone have responded to that, I document all those kind of steps because the team also in South Sudan was start growing, and when the new person joined the team, definitely I share with them those kind of resources so that also they can be updated on those things. And also in the mid 2022, also we expand the team in South Sudan. So we have a lot of colleagues who have managed to join us. Some of them with a strong background in system development. Some of them are having strong background in data analysis, data science, and all those kind of fields. So we create a pool of experts within the country in South Sudan, and also we share all the best practice between ourselves. And also what we decide to do as a team in general is to create our own user manuals based on the issues that we are facing. So in case we found any kind of best practice within the community, we document it down, and we share all those kind of resources between ourselves. Project that we got engaged in 2024. So in 2024, we have a project for strengthening the South Sudan health data infrastructure and improving decision making at all levels of the healthcare system in the country. So the activities that we managed to do in 2024 is that to create a Power BI dashboard linking the DHIS2 with Power BI, because we notice like we have a gap at the facility level. Like, for example, sometimes you train people at sub-national level, and for some reasons they will leave the position and they will join other implementing partners, and they will create a gap within the sub-national. So we did a lot of trainings, but at the end we find out that it's not solving the problem. So what we decide to do is to create something dynamic, something simple, something that everyone can just use without having a strong background in DHIS2 analysis. So this is one of our project. And also we managed to transfer or migrate the data of quality of care data from one instance from another server to the DHIS2. So we customize the quality of care data within the system, and also we managed to transfer all this data to the DHIS2. The other beauty thing that we managed also to do in South Sudan in 2024 is that we managed to create a custom app application in the DHIS2 to manage the birth notification within the country, because previously the country doesn't have a proper system for the birth notification. So, and everything was just manually. They register all the details of the newborn in the registers, and they have a paper-based certificate whereby they will just fill those information in the paper-based, then they will stamp it, and people are using it as a birth notification. But in the beginning of this year, we decided to digitalize this tool using the DHIS2. So we customize the tool within the DHIS2, and also we create the custom application app so that it can generate this kind of certificate automatically. And instead of using maybe a stamp on the certificate, we decide to use the QR code for confirmation and all those kind of things. And the other thing also that we are working in is the ICD-11. So we are trying to localize the ICD-11 in the country. And now the initiative is ongoing. We're almost 80% finishing it. And we hope maybe 2 weeks from now, the ICD-11 will be ready. And in January, we will just implement it across the country. So at the moment, we just select like 10 facilities for in January. We will implement the ICD-11. And after that, we will add other 30 facilities so that we can have 40 facilities across the country implementing ICD-11 using the DHIS2. So the next slide. Yes, next please. Yes, the next slide is showing the Power BI dashboards that we have managed to create. So the first one is the overall dashboard that we have created, and it's for analyzing the HIV data across the country. And what we will do starting from January is to expand this dashboard to all the programs within the health sector, so that also it will be a comprehensive dashboard. Because one of the things that we have noticed also is that implementing partners across the country, what they do, they download the data from the DHIS2, they upload it to the Power BI, and they create those kind of analysis. So it's like each one and every implementing partner is having its own dashboard. So we decide to harmonize everything and have one single dashboard that will have all the analysis in Power BI. And instead also of downloading the data from the DHIS2 and uploading it to Power BI, we decide to use the custom app to do that. And also in some scenarios, we use API calls from Power BI so that we can have those kind of ready analysis. The other Power BI dashboard also we created for the Health Transformation Project, which is a project that is running in the country for 3 years. It started in July. So we create this dashboard to enable the senior management team in the ministry and the implementing partners and donors to see the outcomes of that project. And the dashboard is comprehensive. Also, it's capturing all the health program across the country with ready analysis. So people will just click here and there, and they will see the data without that advanced analytic of DHIS2. The other two, it's the two applications that we have managed to create, the birth notification application, and also the ICD-11 that we have adapted. The down picture in your left hand is the sample of the South Sudan birth notification certificate that we have managed to develop, and it's the first application that have been developed in South Sudan by the digital health team in South Sudan in collaboration with DHIS2 South Sudan and also all the implementing partners. So in South Sudan, what we have a group of people led by the Minister of Health and also DHIS2 South Sudan and also all the implementing partners. So what we did, we created a group of technical people where they can sit together and they can discuss and they can see the major problems that the country is having and fix those problems and give the recommendation to the senior management team. The data of quality transfer, this is the number of data that we have managed to transfer. So we transfer like 8,300 data of PHCU and 390 PHCC and also 475 hospitals data. So this data is covering from July 2019 up to June 2014. Thank you, Garcias. Shukran.
Thank you so much, James, for your presentation and for sharing all the community experience with the community and with your team. I'll quickly go back to our presentation, short fun fact. And so the first topic and post in 2024. So this was actually the first day in the year 2024. Looks like Ahmed was trying to upgrade to version 40. So it's a good way to start a year to make sure the upgrades are going to work and to use the latest versions of DHIS2. Thank you for sharing this post and being the first to post in the year 2024. Actually, if you're wondering, so the COP topics go all the way back to, we have the oldest post imported into COP in 2001. And these very old posts are actually from a mailing list in Launchpad, and then a migration happened, an official migration, where all the previous mailing lists were inputted into the community practice discourse platform. There are many reasons why, the knowledge base is now in the one platform. People can start threads, they can start new topics. We can have a whole presentation about that, but it's also mentioned in previous year presentations. And the oldest topic post created on the COP is in June 2018. And this one is not like the system topic post or core team topic post from a community member. The longest and most active topic. So if you're wondering, introduce yourself is the longest and most active topic, where we have 435 people posting, so many likes and views. If you have not introduced yourself in the community practice, feel free to go to the topic and share the vibe. So most liked topic of all time. This was a topic post announcement for the annual conference in 2022. This one received the most likes of all time. The last fun fact before we move to our third community presenter. New members who created the most topics. So new members from 2024 are from India, Spain, Malawi, Gabon, Nepal, and Tanzania. So thank you for creating the most topics. So people who created their accounts before 2024 might have created maybe more topics, but these are only topics created by people who joined in 2024. Okay, so before I move to this one, our third community presenter, Bhavna, would you like to present now, please?
Thank you, Kasim. Yeah, I'll present my screen now.
Thank you.
Please let me know when you are able to see my screen. I hope my screen is visible now.
Yes, yes, thank you. Yes.
Okay. Good morning, good afternoon, good evening, everyone. I'm Bhavna. I am based in Bangalore, India. I'm a project manager for ICT. Exciting to meet you all. And it was very exciting and interesting to listen to Matthew and James before me as well. And listening to their experience with the community of practice, and seeming like, you know, the veterans that they are, who've been working with the practice for so long. If I may say so, I think I present a contrasting perspective in the sense that I've only been working with DHIS for about a year now. And it is, I think, a testament to Gasim and Matthew and James and all of the other people that are a part of the community, that I was able to be up and running, be functional, and start delivering projects because of all the discussions that you have all had within the community, the answers that you've posted. That is basically what also helped me to scale up my own knowledge of DHIS and start delivering projects. That's just my perspective, but I'm also representing ICT today. ICT, however, is not new to DHIS. ICT, I think, started working with DHIS in 2015. And is responsible for a lot of the generic apps that are available today. This lists a few of the apps that we have developed, and I think it also features the metadata sync app that won the web app for this year, for 2024, in the DHIS conference. Yep. And from a ICT perspective, I think the community of practice makes so much sense for us because it's where we can collaborate with other people who are using the system, pose complex scenarios, questions, get answers, also share our own knowledge, and also a very interesting use is where we look for people who have experience with the community of practice so that we could hire and recruit into our organization, which I think is a very exciting opportunity. And of course, the opportunity to meet all of you amazing people. So thank you all for that. A couple of quick pictures and photos on the COP badges that we got this year. As you can see, we have Nacho with the app competition winner, and also we got the award on the most active in the COP. Couple of more photos from the DHIS conference and also from one of our internal meetings where we were basically discussing the learnings from the COP. Okay, and today basically we would like to kind of cover in 2024 the activities and goals that we've kind of achieved from the ICT perspective, and talk in detail about a couple of projects that we have implemented using DHIS as the base. One is a custom web application and the other one is a custom Android application, both using DHIS as a base. So I'll talk about both of these applications in detail. I don't think I have a time for a demo on these, but if anybody's interested and wants to learn more about how we implemented it in more nitty-gritty details on some of the challenges that we faced or how we overcame those challenges, please feel free to either visit our website or send us a note, and then we will try and respond as best as we can. We are also planning to kind of create a couple of YouTube videos on both of these projects. So we'll share that with the community as soon as we're done with them. The first project that I wanted to talk about was the integration of biometric identification and verification with DHIS. So this is a project that we did in collaboration with an NGO called Simprints, where Simprints and ICT together developed this custom Android application, which is based off of DHIS2's Android e-tracker application. And basically, this was used for tracking the immunization and vaccination, like for tracking that for malaria in Ghana this year. It was piloted within 2 districts of Ghana. The pilot went very well. It was successfully received, and now the plan is to roll out this application to about 500 clinics in Ghana this month. In fact, we are in the process of doing the last setup, and I think in a week or two, this application is going to be live in 500 clinics across Ghana. Some of the main things to highlight, I think, about the application is it basically, so the way that the application is used is it is available on every single mobile device that the frontline health workers use, either in a mobile device or a tablet or any Android device, basically, where they are able to register any patients who are visiting their clinic. And along with registering, also capture the biometric information of the patients. The biometric information could be captured in 2 ways. It could be either fingerprint-based identification, or it could also be facial recognition. So our custom application allows for both. So you can pick and choose if, depending on your need, you can either do fingerprint or facial recognition, or you can even do both, and that's completely configurable. All it takes is a setting in DHIS, and then your program can be configured to use one of these 2 modalities. And that again gives you the advantage that you could do contact and contactless with both these methods. So in case you have like a outbreak like we had with COVID, and then it's not appropriate for you to have contact-based identification, then you can always use the contactless as well. So that was the idea behind providing multiple modalities. Also, the good thing is, because it is based out of the DHIS Android application, the application is available for offline use, which means that if you are in a remote place where there is no electricity, no internet, you can still use the application to register all of the information that you need. And when you are in the range where you have internet connectivity, at that point, you can do the synchronization, and that information gets uploaded onto the server. Until then, it will reside within your device. So I think that is a key part of why this was successful in Ghana in the pilots, because the places, the districts that they were implemented in were quite remote, where regular internet access is simply not realistic to expect. And therefore, the availability of doing this without internet in an offline basis really made sense and really made a difference. And obviously, this led to efficient patient management because you can basically track the history of that patient. And the good thing about the Simprints biometric implementation is that it is able to recognize and verify biometrics for children uh, as young as 6 months, which I think is a very important thing, because which means that from the time of birth onwards, from the time of birth, you can use the facial recognition to capture the information, and from 6 months onwards, you can also use the fingerprint. So which means that from the time a child is born, you can basically cover that child's entire patient history. And something that was not possible before is now possible, because you're having complete access to the history of the patient, all the immunizations that that child has gone through. And that basically makes health workers' lives that much easier. And of course, all of this is affordable and expandable. All you need is an Android device for facial recognition and this very affordable fingerprint scanner that Simprints has developed. Yeah, I think what this has resulted in is basically faster access to healthcare, accelerated responses to healthcare needs to people who are in very remote locations. That is the crux of this particular project that we implemented. The second one that I want to talk about is the Zambia Emergency Bridge for Response application. So this basically is a custom web application that we created for the government of Zambia. So Zambia has an existing ecosystem where they are maintaining event or outbreak related information. So basically they have their indicator based surveillance and event based surveillance techniques, on the basis of which each district is reporting any outbreaks or any events in the form of like death clusters or anything of that sort, whether it be like animal deaths or human deaths. All of those are being reported in their DHIS system. But what they lacked was a centralized view, a centralized place where the information from all of these districts would be collated, and it would be possible to view it at a national level, and also have a centralized place for responses at a national level. So up until now, I believe districts and I mean, there was no application or place where this information was readily available, and that was the need for creating Zebra. So with Zebra in place, now they will be able to better respond to any outbreaks that might occur across the country. Basically, the way that Zebra is designed is that it gives you information on what type of disease outbreak has been reported in which district. It also gives you a geographical view of, and if I could just pause for a moment, and I will just also try and show you the application so that you can have a better picture. So as you can see here, it gives you a list of all the different outbreaks that have been reported. The application also gives you a notification when any new disease has been reported. So if I am part of the National Watch staff, I would then know that, okay, there is something new that has been reported that requires my attention and may require a national response. We also provide a geographical representation of the distribution of the alerts. So as you can see here, your eyes directly pull to the central province and tells you that there are some outbreaks over here that basically need to be addressed. Apart from providing the information of where the outbreaks are being reported, you also have 717 metrics on the response to these alerts. So basically, 717 metrics, what they tell you is how soon was a particular outbreak detected. Whether if it was detected within the first 7 days, then we consider that that is ideal. And after detection, how soon was it notified? After it was notified, how soon was the response formed? So I think that forms the crux of how you are assessing whether where there are problems. So in this example, if you see, you can basically say that we are saying 95% of your events were detected early, but your notification is what is kind of slow. So that allows a national level stakeholder to basically put the resources in the right place so that he knows that, okay, it is this particular team who is doing the notification, so probably need more help because they are not able to meet their metrics. So that allows them to use the application to determine what is the most urgent problem that needs to be addressed. So right now what you see is 717 metrics at the national level. In the next iteration of our development, we are planning to introduce 717 metrics at the district levels as well, which basically means that when the districts are individually reporting the alerts, at that point itself, you can start pinpointing and finding out whether there are any gaps in your entire event management process. And that basically allows you to address a problem before it becomes a problem. Okay, in this section basically shows you all of the different alert events that are currently residing. It also gives you for every individual event, like how soon it was detected, how soon it was notified, etc. It also gives you a view of how many cases exist for each of these outbreaks, and how many deaths were there, etc. And then you can also deep dive into each one of these diseases, and you get a more detailed information about that particular disease outbreak. So if you see this particular example, you have subjective details about all the actions that have been taken or any background information that one would need on the outbreak and the response to that particular outbreak. So this gives you that information. It tells you what districts are affected. It basically tells you that these are the number of cases that exist in this province. If you want to drill down, you can actually drill down and see the information at the district level so that you know what district is affected the most. You can also look at the, you can also create a risk assessment. So basically when you have an outbreak, you can assess what is the grade of that particular outbreak, and that will basically define what is your response to that particular action. So based on what is the geographical spread, what percentage of the population was affected, what is the capability for response that you have, what was the severity of the outbreak, all of these things, when you input this information, it basically gives you a view of how you can basically grade that particular outbreak. And then based on this grade, you can decide what kind of response that you need to have. You also have some other details about that particular event. I know, Wasim, you've raised your hand. Am I running over?
Yeah, if you could continue, but Yeah, we still have just a few minutes
Sure.
for the
Okay.
presentation.
Sure. Cool. So I think I'll probably stop the demo here, but I'll just go back to my slides. So yeah, just to conclude, so this application also it basically gives you information on how you can it basically allows you to manage your event from start to finish. I think, yeah, that's what I will stop with. And then now going back to the, sorry. Yeah. Okay. Yeah, so can you still see me? I'm seeing something saying signed out.
Yes, it says signed out. And, looks like you need to verify your.
Okay, sorry. Yeah, just coming back to the highlights of this, I think the whole point of this application is that it allows you to streamline your incident response, and all of this is done with a custom web application, but with DHIS in the background. Yeah, I think that's all. Thank you to everyone. And I think thank you from the entire ICT team. All of these people are whom I am representing today. So all of this that I just showed you is a combined effort from all these people. So I think that's all from me. Thank you, everyone. And sorry that I went over.
Thank you so much. It's great to hear from you. And one amazing thing is that it's great that you work as a team and also use the resources of your team to help and support the community. That's really great. Austin, would you like to present now?
Sure, yeah. Okay, no problem
Great,
at all.
thank you. I'll develop her.
Great, yeah. Hopefully you can see me and see my screen. Yeah, there we go. Hello, everyone. For those of you who don't know me, my name is Austin McGee. I lead our extensibility team here at DHIS2. I've been involved with the developer community and the work that we do to make DHIS2 adaptable and applicable to many different situations. So I wanted to just give a quick roundup of some of the things we've been doing for the developer community and some of the things that the developer community has been doing, some kind of roundup stats that actually Gassim helped me to put together for what's happened in 2024 with that developer community. So we've had a monthly meetup with very good attendance quite often from the community and some great presentations from all of you, from developers and people that are building things on top of DHIS2 and want to share that with the rest of the community. So this is just a laundry list of some of those presentations. Had some really, really interesting ones, really exciting innovations that are happening around the world with the DHIS2 development platform. Had 368 different attendees in those monthly meetups, more than 100 people, individual people that have gotten the meetup badge. I think there are several or quite a few other people who maybe didn't request a badge also. But when you join one of these meetups, you get a unique link to add an attendee badge to your community of practice profile, your COP profile, and so that will, this is a kind of a way to recognize the people that are contributing to this part of the community as well, by attending these meetups, both presenting and attending to learn from other people, as well as to ask questions and to share some of the things that they're doing. Also wanted to give a shout out to the app competition. We heard a lot about it earlier with the metadata sync app and ICT. Had some great submissions from the community this year, and really a high quality set of finalists who the whole community voted on during the annual conference this year to select a winner. Now I wanted to talk a little bit about some of the things that we've built for developers. I know this isn't strictly a developer audience, but many of you are developers on here as well. So I'm not going to go into any technical detail, but talk a little bit about some of the things that we've built and why we think they're useful to the community as a whole, and to developers to help serve the rest of the community and the use cases that DHIS2 serves. The first one I want to talk about is actually hopefully coming out today. So we'll be having a post on the Community of Practice, a blog post on the developer portal for the next version of the app platform. Little bit of technical detail, but under the hood, we're upgrading some of the things that we use that makes it very fast to use, more modern, using the latest version of React, almost the latest version of React. React 19 came out a few days ago, but React 18 is supported, and Vite is a really great tool for being able to build and iterate quickly on the development of web applications for DHIS2. Another one that's really exciting for developers, but I think even more so maybe for the community as a whole, is the ability to create capture plugins. So in the Capture app, and I'll actually have a brief demo of this in a few minutes, within the Capture app, sometimes you want to change just a small piece of the form that you're using to enter data for individuals' records, or you want to put a widget on the dashboard for a particular tracked entity. And we've added the extension point within the Capture app to do that. So you can build a web application that plugs into a very small portion of the Capture app and lets you customize the interface and the functionality of collecting data for individuals within Capture. And you'll see more and more of these plugin extension points coming into DHIS2. We've had the one in the dashboard to be able to add dashboard items for a long time, but you'll see more and more of these coming. And I think it's a really powerful way to allow customization without needing to reinvent all of the data entry application, for example, to get to what you want to do. We've also released several integration tools. So it's been a little, maybe a year and a half now since we officially released a Camel DHIS2 component. That's actually in the Apache Camel project. So if you're using Camel, you don't need to kind of go get some third-party tool or anything. It's an official part of the library that is supported for Camel. That allows you to use Apache Camel for integrations between different services and talk kind of natively to DHIS2, the DHIS2 API. And we have a proof of concept that is being worked on that's pretty exciting about how to kind of package up some of the standard ways that you want to interact with different health services, health systems in Apache Camel, and have built some tools that make it easier to kind of leverage that tooling for integrations. And we've had 2 trainings this year as well on integration and interoperability that I think have gone really well in Rwanda and Sri Lanka. And a lot of people are interested in learning more, and we're working with the community on how we can best serve real integration use cases in the field. API routes are a really cool feature as well, to be able to securely communicate from a DHIS2 web application to a backend service through DHIS2. So you'll let DHIS2 provide the authentication, the authorization, check whether a user has been given the right to use this backend service. Also can perform some more interesting operations based on the user that made a particular request. So this was actually added in originally in version 40. It was improved in version 41, and just in the last couple months, we have a new application on the App Hub for creating and managing and testing those routes as well. And we'll be actually kind of doing a formal launch of that in hopefully in January to share what that is and how you can use it to manage the routes in your system. We also have a new data store app. So the data store app that is in DHIS2 is a little bit old and tired. It also doesn't support the user data store, and many of the new features of the data store API, such as filtering, field selection, sorting, some of those types of things, that will be supported in the new application. And it also just looks better and makes it easier to interact with the data store, which many apps and plugins are using to configure themselves, to save data. I think it's a really powerful tool. Another one that's really exciting is a Fire implementation guide generator app. So this will be launching pretty soon. It's something that we've seen a lot of interest in. And basically this lets you take your DHIS2 program metadata and turn it into a Fire shorthand files that you can use to generate a Fire implementation guide. So you can describe the metadata in your DHIS2 system in a Fire way so that other systems can interact with it. And we see this combining with the integration tools that we're building to be able to more easily have direct kind of integration between Fire and DHIS2 systems. And it's a really cool tool to be able to kind of explore the metadata as well within your DHIS2 system using the Fire terminology and a Fire implementation guide. So the last thing I wanted to talk about, and I'll have a few slides on this, is the first example of what we're calling a reference implementation. We've had a few examples of using the developer tools that we have out released in different places in the past, but this is the first kind of full end-to-end example of how you could use some of the tools that we build to create a civil registry lookup within the Capture application. So what is a reference implementation? Generally, this is an approach we're trying where we build something that is generic, that uses some of the extensibility points, extension points within DHIS2 and some of the tools that we build to address a fairly common use case. But it's not a core feature of DHIS2. It's just an example that you can use. You can take it and use it yourself. You can take it and modify it and use it for your implementation, which was often necessary because every civil registry is different. Every implementation is a little bit different. So this allows you to, with a minimal customization, support many common implementations, but also leaves it open for people to fork and to extend this implementation to be able to apply to their particular use case. So this first reference implementation that we've developed is about, as I mentioned, integrating the Capture app with a civil registry. So very basic problem statement is that you are registering a new tracked entity, a person or a patient in this case, in the Capture app, and you want to type a national ID and automatically fill in the demographic information for that person. So that's something that right now, if all of that information is already in DHIS2, that's fine. But if it's coming from some external system, it's more complicated to do. And you can do it with data integration. You can do it with a fully custom app, but it hasn't been super easy to do it within the context of the Capture app in DHIS2 up until now. And so that's what this reference implementation is showing you, how you can solve using the extension points that we have. And it gives you a kind of a baseline that you can build on or adapt to your particular use case. So these are the primary components that make up that reference implementation. We use a Capture plugin, which I mentioned allows you to extend the functionality of the Capture app. We use an API route to securely communicate between the Capture app and a civil registry that maybe is not exposed to the public internet. Maybe it's only accessible through DHIS2, for example. And we use a custom middleware service built on top of Apache Camel, which lets us do the translation between what the civil registry is, the API of the civil registry, and what the Capture plugin is expecting. So that you can also use that layer to transform what to work with different civil registries, as well as to perform authentication with that civil registry. And in the example, we use OAuth. So you can actually do server-to-server OAuth authentication between the DHIS2 route and the civil registry backend. Here's just a quick diagram of what that looks like. Again, some of this is technical details, but the next slide will be what it actually looks like to the user and what the end result is, which is what we're all after. But these are those pieces. We also use the Route Manager app to manage the API route that you need to install. There's a tracker plugin configuration app that was built by one of the people on the core team, Eirik, that is a very cool way to kind of customize the look and feel of your Capture app by adding plugins. And then it talks to, the Capture plugin talks to the API route, which talks through the Camel middleware to the backend civil registry service. But what does that look like to the end user? So this is just a very quick demo. First I searched for a patient that doesn't exist using their national ID. I get an error back. But if I do search for one that does exist, it automatically fills in all of the demographic information very quickly coming from that civil registry that's live lookup of that national ID. So again, have an error, and then we'll see the demographic information come in for one patient, and then for another patient, just to show that it's different for different users. So that's basically it. It's pretty simple in the front end here. Where that search bar is, that's the only part that's custom. Everything else is just the standard Capture app, program rules work, all of that. But you can search for a patient by national ID. That does a lookup in the civil registry, whatever that civil registry happens to be, and fills in the other data elements or attributes for this particular person based on the result from that civil registry lookup. This is just an example of kind of the power of it's a very small bit of user interface that's customized here, but it can really be a way to serve use cases that are a bit awkward or challenging to do with the standard built-in Capture app interface. So that's all that I had for today. I'm very open to send me some questions if you want. Post the questions on the Community of Practice, and we'll respond to them. We'll be having some more details about this reference implementation and some of the other work that we're doing on the Community of Practice and on the developer portal coming up soon. Yeah, thank you very much for the opportunity to share with all of you, and thank you to the community for being you. Really appreciate everything you do and the thriving group of people that get together and get passionate about these things. So thank you.
Thank you so much, Hassan. Thank you for your presentation and for the talk in the end of year event. I know we're running over time, but what I want to do is I would still want to share 2 COP fun facts, and then we'll open the interactive for participants who would like to continue in the mentee interactive. So if you probably most of you already know these 2 badges and recognize them. These were the 2 most earned badges in the community in 2024. The basic one is when you reach a trust level 1, that means that you created accounts and you're interacting, you posted things into the community. And the anniversary one is very special because it means you've been there for a year, but with at least 1 post. So those were the 2 most earned badges, and it shows the community for its growing as well as a continuation. So There are two other badges that you could also get in the community practice. So if you haven't, you might think of it as the next thing to do in the community practice. So one is the certified badge and the other one is licensed. And when you get those two badges, you also get two DHIS2 community certificates. When you go to community, look for the user DiscoBot or send a direct message with DiscoBot display help, and you can find how to start these two tutorials. The good thing that I want to say is we have customized it. So we've customized it so it's a DHIS2 customized tutorial. If you had received this or completed the tutorial before, now it's a new one that we created. So make sure to get it after as soon as you can. So this was the final COP fun fact, and I'll start the Menti. So if you're new to Menti, you need to go to the website menti.com or scan the QR code and enter this number here. When we see people joining, and I'll move to the next question. So the questions here in the Menti were first community based and then some developer questions, but that are actually educational for everyone. And the developer questions were prepared by Ren. Please make sure to also add or use the hearts so we can see people joining. Great. So people already waiting for more people to come in so we can start with the questions. Most of you who joined the monthly developer meetup are familiar with this already, and also in the annual conference and many of the events. But some of the questions are new, and I'm looking forward to seeing how many people get the correct answers in the community. Okay, great. More people joining. See numbers increasing. So thank you. If we start with the questions, more people can still join. So once we start, if we start and you haven't joined it, you can still answer the questions and follow up. So here we go. The first question. First questions are from the community. Oh, nice. Okay. What is the tag for the annual DHIS2 conference in 2025? This is an important one. If you want to participate in the annual conference, whether virtually or in person, you need to know how to use this tag and which one is correct. Okay, good. Right. So DAX 2025 is the tag we use in most of the annual conference. In all of the annual conference, if you answer DHIS2 events, it's not the tag we use in the community. Okay, so next question. What can you post in the support category? Feature requests or user stories, technical issues, potentially a bug issue. So if you suspect there's a bug issue. Technical issue, right. technical issues, and potentially a bug issue. Most of you got it correctly. Feature requests, mostly in the development section. User stories, mostly in the implementation or development category as well. Which category had the most news posts in 2024? I think that's not a difficult one to guess. Maybe I should say topic posts, but yes, the support category received or has the most news posts in 2020. Okay. How many online academy course discussion forums are currently in the COP? You know, before they were in Open edX in the older courses, but in the new courses, that's the question. Are they in COP? See if they can any of the latest DHIS2 online courses. Actually, all the 14 courses have discussion forums, including the French, the Spanish, and the Portuguese version. All right. What percentage of COP members identify as DHIS2 experts? You might be able to guess. We did say the number from the fun fact. More than 700, but what percentage is it? Might be difficult to calculate the percentage. You were very close, but it's 8.28%. That's a question when people create their accounts in the answer. How many COP signups in 2024? It was a year. It's been a great year. See how many people get this. Yeah, more than 3,000 people joined the COP, or we have COP account signups. Which country has the most COP accounts? Can you guess? Of all time, not just this year, all time, we have most COP accounts from Nigeria. Correct. Maybe you should work on inviting all your team members and everyone you know in your country is interested in DHIS to join. How many online academy course discussion forums are currently in the COP? I think we've answered this question, so I'll move. Okay, there you go. This is the quiz leaderboard. Wow. Cool. Chris, James, E3. Okay, great. So that was for the community kind of questions. Now these questions are for the documentation AI. So if you go to docs.dhis2.org, you'll find the AI there. These questions. Let's start. Okay. So first question. What is the software for the documentation AI called? Usually, every AI has their unique name. So the one that we're using in the docs page, what is it called? Good. Kappa.ai. All right. What does the AI in the documentation do? When was the documentation AI introduced? It is very recent. It's this year for sure. It was actually implemented into the developers.dhis2.org site first, and then into the docs page. April. Yeah. Honestly, personally, I don't remember the month as well. What does the documentation AI not know? It's something we usually need to search to figure out if it's a feature, if there's already a feature request or a bug ticket or yeah, actually, so the AI has scanned the DHIS2 YouTube videos. So a lot of the videos already, you know, the transcription and the captions are recorded there. New ranking. See, nice. Megamind was the fastest, so now the first. Okay, so the third and final section, which is the development section as well. And here we go. What DHIS2 version was released in 2024? I think if you remember, it was a major change. We also we say version 40, version 41, version 41. Any players ready? Couple of questions left. What new feature does the next app platform framework have? This one, I think, is for the developers mostly, but it's okay to guess. Time travel capability. Okay, React 18 plus support and Vite support, right. What was the topic of the only developer webinar in 2024? Actually, it's the recent one, if you remember. We also created a new badge for that one, which is a webinar learner. Capture plugin. What topic does the developer portal not contain? You'd need to be a developer, someone who has checked the site out, developers.dhis2.org. The API reference. Right, the Android SDK guides are also now in the developer portal page. There is also a new layout and many changes, so make sure to check it out. There you go, final quiz leaderboard. Yeah, the ranking here. Congratulations, Megamine. If you want to share on the Zoom chat, go ahead. So thank you, everyone. Thank you for joining today at the end of year event. It's been very special talking to you. Thanks to the speakers, Matthew, James, Babna from ICT team, the whole team, and your teams, and his South Sudan. Aston, thank you for the developer talk, and thank you everyone for participating. Make sure you can comment in the COP topic post if you have any questions. Follow up with the speakers, and I hope you find 2025 with more knowledge and more experience, more friends, and more of the nice time. So thank you everyone for your time today. Remember to get your badges to the tutorial at DiscoBot. I'll send you here in the Zoom chat at DiscoBot. Send a help message and you'll get the badges and 2D DHIS2 community certificate. As well as check out the new customized tutorial. Right. Thank you for your time. I think we're already over time, so we're ending the event.
Thanks.